Hello, I'm Dr. Richard Mays, a board-certified geriatric physician, and I've worked with older adults for over 30 years across the United States. Today, I want to speak openly and scientifically about a subject that many seniors avoid: intimacy. What really happens if you stop having sex after 65? Not just intercourse, but all forms of intimacy, including touching, affection, and even masturbation. If you're a senior or you care for someone over 65, this information could change the way you view aging, health, and emotional wellness. Let's break it down medically, emotionally, and practically. Section 1. Why many seniors stop being intimate. The first thing to understand is why intimacy tends to fade with age. Most people assume it's because of a lack of desire, but that's not entirely true. For many seniors, the reasons are more complex: loss of a spouse or long-term partner, chronic pain from arthritis or injuries, fatigue from diabetes, heart disease, or medications, reduced hormones, testosterone and estrogen, both decline, cultural shame or fear of judgment, depression or isolation. Even if the mind desires connection, the body may not respond the way it used to. And that can create a cycle of avoidance, frustration, and resignation. Additionally, many seniors grow up in generations where talking about sex was taboo. That silence often continues into older age. But we need to change that. Touch, affection, and even sensuality remain vital human needs at any age, and neglecting them can have consequences. Section 2. Biological consequences of avoiding intimacy. Let's talk about your body. What actually happens when you stop being sexually active? Circulation drops. Sexual activity stimulates blood flow throughout the body, especially in the pelvic region. Less activity can lead to tissue weakening, loss of elasticity, and discomfort. Hormonal decline speeds up. Men experience faster testosterone loss. Women lose estrogen more rapidly. That affects muscle strength, bone density, memory, and even metabolism. Prostate issues in men. Several studies suggest that regular ejaculation reduces the risk of prostate enlargement or inflammation. Vaginal atrophy in women. Without stimulation, the vaginal walls can thin, causing dryness, pain, and even urinary infections. Weaker pelvic muscles. Pelvic floor strength is critical for bladder control. Orgasms and regular stimulation help keep those muscles active. Avoiding intimacy doesn't protect your health. It may silently accelerate decline. Section 3. The brain on sex. Now let's shift to the brain. When you engage in sexual activity, your brain releases powerful chemicals: dopamine, the reward hormone oxytocin, the bonding hormone serotonin, the happiness hormone. These are the same neurotransmitters that antidepressants try to regulate, but your body can do it naturally, through intimacy. Sexual activity, even gentle or solo, boosts mood, lowers stress, and helps regulate sleep. Seniors who remain sexually or emotionally connected show lower rates of depression, cognitive decline, and even dementia. A long-term study from Johns Hopkins found that sexually active seniors scored better on memory and verbal reasoning tests compared to their non-active peers. Other studies even link intimacy with increased life satisfaction. Section 4. Immune system and longevity. Here's something most people never expect. Intimacy improves your immune system. A study from Pennsylvania showed that seniors who were sexually active at least once per week had higher levels of immunoglobulin A, a critical antibody that helps defend against infections. Regular sexual activity has also been linked to lower blood pressure, reduced cortisol, stress hormone, better cholesterol levels, improved heart rate variability. It's not magic, it's biology. The body treats intimacy as a signal of vitality, and when that signal disappears, so can some of your natural defenses. And remember, these benefits aren't limited to intercourse. Gentle touch, affection, even meaningful eye contact can have neurological benefits. Section 5. Is masturbation safe in older age? Let's address a common question I get in private consultations. Doctor, is masturbation okay at my age? Yes. Not only is it okay, it can be beneficial. For men, it helps keep the prostate healthy and supports erectile function. For women, it encourages vaginal lubrication and reduces dryness. It also improves sleep, lowers stress, and provides a sense of emotional release. Just be mindful. Don't strain yourself physically. Use lubrication if needed. Avoid guilt. It's natural. Solo intimacy is not a fallback. It's a valid, healthy practice. Section 6. Psychological myths that harm seniors. Unfortunately, many people over 65 carry damaging beliefs about intimacy. Let's name them. Sex is only for the young. I'm too old for affection. If I'm single or widowed, it's wrong. My body isn't attractive anymore. These beliefs are cultural, not medical. They are outdated and emotionally harmful. Touch, connection, and emotional closeness are not luxuries. They are basic human needs. And these needs do not vanish with age. In fact, they intensify, especially during times of grief, illness, or transition. True sexual health isn't about performance. It's about dignity, consent, comfort, and emotional safety. Section 7. Real-life case stories. Let me share 2 real stories from my practice. Case 1, John, age 72. After losing his wife, John shut down emotionally. He avoided all touch, even hugs from his grandchildren. Within a year, he began experiencing insomnia, weight gain, and urinary issues. After counseling and being gently encouraged to explore safe solo intimacy, John slowly reconnected with his body. Within 3 months, his sleep improved and his urinary health stabilized. Case 2. Maria, age 68. Maria was in a long marriage but avoided physical contact due to fear of pain. She believed she was broken. After starting gentle topical estrogen and practicing self-touch with guidance, she regained confidence, and her relationship with her husband became tender again. They now walk holding hands and laugh like they did years ago. These aren't fairy tales. They're medical outcomes from honest, dignified conversations. Section 8. Doctor's advice. Here's what I recommend to all my patients. Stay in touch with your body. Even gentle, non-sexual touch is healing. Talk to your partner. Intimacy starts with emotional connection. Ask your doctor. Don't suffer in silence. Help is available. Release shame. There is nothing undignified about wanting love and connection. And if you have any medical conditions like heart disease or pelvic surgeries, always get proper clearance first. But remember, intimacy is not indulgence. It's a part of your overall health. If this video helped you understand your body or opened your mind, please consider subscribing. Here on our channel, we bring you science-backed advice tailored to the senior community, without shame, fear, or misinformation. Stay curious, stay connected, and never stop honoring the incredible body and heart that carried you this far.